One of the key figures in the early days of regulating new drugs in the United Kingdom was Professor Bill Inman. Sadly, he had bad polio when he was a medical student, and he now has to spend all his time in a wheelchair. And so I went down to see him at his home outside Southampton and talk about the beginnings of the Committee on the Safety of Drugs. So can you tell us how it all started?
Well, I suppose, Stephen, the first indication of trouble was 1956 when Dr. Mukhtar of Rheinchemie Grunenthal invented thalidomide. It was marketed in this country the following year as Distaval and in Germany as Contergan. And 2 or 3 years passed really before it's alleged that Bill McBride in Australia spotted an association between thalidomide and congenital abnormalities. And Widekun Lenz in the same year said he'd seen 52 babies in Germany with these limb problems. And following on that, I was at that time working with ICI in their medical department, and almost out of the blue, I had discussed this at meetings of AMAPI, which you may remember as the Association of Medical Advisors in the Pharmaceutical Industry, and so it was known that I was interested in setting up some sort of a scheme to monitor new drugs. And out of the blue, a letter came from Sir Derek Dunlop in the end of '63, inviting me to show an interest in the new committee he was forming.
The committee had been set up by then?
It had established, as far as adverse reactions were concerned, the total number of yellow cards was the contents of one shoebox, literally. When I joined, and I would in fact have been in right at the beginning had I not been late starting. I was ill.
So what was your background? How did Dunlop choose you?
Well, it's rather obscure because the letter from him came completely out of the blue. But I had been, at the time I was working in ICI in their medical department, and I had been showing an interest at various meetings in the possibility of setting up some sort of a monitoring system.
You were working for ICI? How long had you been there for?
I'd been there for about 5 years, I suppose, by that time.
Yes. And this was because of your polio, or because you were interested
that
in...
was my choice of career was really dictated by the fact that I had polio as a medical student.
Yes.
And it seemed that it was skin psychiatry or something, laboratory work, which didn't appeal to me.
And you did, of course, have quite an ICI background.
It had been in the family since the early 20s.
Yes.
My father was a founder member of the company.
Yes, So you get to the committee in 1964, and what's happening?
Eventually arrived in 1964, by which time yellow cards were just beginning to trickle in, and there were various bits of publicity to encourage that. Derek Dunlop himself wrote a letter to all doctors, circulated it with yellow cards, and they started to come in. I can't remember the exact rates, but I mean 1,000 a month easily, and maybe more than that.
Who was the chairman of the committee?
The chairman of the main committee was Derek Dunlop himself, and he operated 3 subcommittees. The first was a subcommittee on toxicity, which was the chairman of that was Professor Fraser. The second was the clinical trials committee, Robert Hunter, Bob Hunter. And the third was adverse reactions, Leslie Witts.
Yes. This was really the subcommittee that the attention was focused on.
I think it certainly could be the most dramatic when things went wrong, as with the pill and the asthma deaths and so on. Yes, we got most of the press attention.
Leslie Witts was the distinguished professor at Oxford.
He was a specialist in blood dyscrasias, and I think that was felt to be one of the target areas we might get involved in.
Yes. And was he an easy person to get on with? And
I liked him very much indeed. He was very quiet, very considerate, a perfect gent, in fact. I was very fond of him.
Yes. And who else was working there on the
the names I can recall, it's now over 30 years, Ecke Kernsberg,
who was a GP in Edinburgh.
GP in Edinburgh. Owen Wade, who at that time was in Belfast. Bill Mushin from Cardiff,
who was a professor of
anaesthetist.
Yes.
Michael Lynette, who I believe was the Queen's general practitioner.
Yes.
Who else on adverse reactions? I think that was about the... Roy Goulding put in an occasional appearance from the Poisons Information Centre.
Yes. How exactly did you work?
Well, the keystone of the whole operation was the yellow card, which was a very simple business reply card, folded double and glued round the edge for security and confidentiality. And these were issued periodically to doctors with who were encouraged to report any suspected reaction to a new drug and any serious reaction to any drug, however old or new it was. And it was an entirely voluntary system. They didn't get paid for it. And on the whole, I think they responded very well. But of course, the yellow cards really grossly underestimated the probable numbers of events which were occurring.
Can you give us some examples of what
well,
action
I can
you did
certainly
actually?
remember the first drug that hit us, struck us as dangerous was a drug called benzoiodrone. It was a drug used in heart disease, and it quite obviously caused jaundice. And the company was persuaded to remove that voluntarily without any pressure.
All that was kept under wraps. There wasn't much publicity.
Well, that's right. I mean, we didn't seek publicity. Another good example was ditransin, which was the precursor of Brufen, which is now still on the market. That did the same thing, 2 waves of jaundice, one when they issued it to hospitals, the second one when they issued it to general practitioners.
Yes. Yeah.
And Boots had no difficulty taking that one off the market straight away.
Yes. So, firstly, the drug was taken off the market. Did you also issue sort of warnings to GPs?
Several times. I can't remember we had a thing called the Adverse Reaction Series, which the company's called the Yellow Peril.
Yeah.
And the first one we issued was monoamine oxidase inhibitors. We put out one on chloramphenicol, which wiped out aplastic anemia virtually, except for the odd patients who'd used the stuff in France or Spain while in the Costa Brava and got a cold and came back to die of aplastic anemia in England.
Yes, yeah. And then there was a particularly high spot or low spot with the pill.
Yes, the pill first impacted about 1965, and there have been odd anecdotes in various journals. I think the first man ever to produce one was a man called Jordan, who described 3 cases somewhere down in the West Country.
These were cases of what, pulmonary embolus or deep vein thrombosis?
Yeah. I think they were pulmonary embolism.
Yeah.
And by about the beginning of 1966, it was obvious that if we'd had 100% reporting, the estimated incidence was about what you'd expect from the Registrar General's figures.
Yep.
And clearly, you couldn't have believed that we were getting 100% reporting. And so we had a prima facie case that the pill was possibly causing thrombosis. And with some difficulty, I managed to organise a national study picking out all the deaths of women of childbearing age that would occur in 1966. I had to wait for them to occur.
Yeah. Yeah.
And following them up, by that time I'd recruited a team of field workers. We called them Derrick's Dolls. And they were personable, mostly young doctors who would actually visit the general practitioners and get the information at first hand, which the doctors appreciated. They felt that it's...
You did this from death certificates or hospital records?
We identified the patients through death certificates, but I also used the same team to follow up the yellow card reports.
Yes.
And so these girls went out and we collected, I think from memory, about 300 or 400 cases. And come the beginning of 1967, there looked like at least a 6-fold, maybe an 8-fold excess of pill users. We took living controls from the same practices.
Yep.
And so this was one first, really, a major first for the committee.
When was this published?
That was eventually published in 1968. But there was quite a lot happened before that, because way back in '65, before we'd even shown that there was a statistical valid case against the pill, I had already spotted a difference between mestranol and ethylene estradiol. And I thought it was possibly a chemical difference. I didn't do very much about it until quite considerably later. So anyhow, late in 1966, Leslie Witz and I went off to the MRC to try and encourage them to set up some parallel studies, because one study isn't enough.
Yep.
And we did that with great difficulty. They were persuaded to do a study, which they did in hospital admissions, not deaths.
Yes.
And we also persuaded the College of General Practitioners to do the same thing, and they did study, a small one, mainly superficial venous thrombosis in general practice.
What was the difficulty? You said you had some difficulty.
Well, they didn't really seem to be very interested, and the family
The MRC
planning,
wasn't interested?
not at first, no. We had
No.
to make 2 visits to them altogether.
Yes.
But once I got some data to show them, they were a little bit more impressed.
Mm-hmm.
And this basically was Richard Doll and Martin Vesey, who I hadn't met at that time. So we got together, and these 3 studies were supposed to be published early in 1967
Yeah.
as a medical MRC report.
Yeah.
But the College of GPs, in the meantime, jumped the gun.
Mm-hmm.
In order to be in first, they published their little series, and so we were forced to, I think, to publish the MRC report prematurely.
Yes. This was all happening just before Christmas, I seem to remember.
No. This is May 67. The Christmas business comes 2 years later.
I see. Mm-hmm.
Anyhow, to cut a long story short, the MRC paper and our paper, Martin Vesey and I,
Yeah.
published on the same day, same edition of BMJ.
Mm-hmm.
And I then, things quieted down a bit after the initial media response. And I then went back to the yellow cards, by which time I had about 3,000 or 4,000 of them.
Mm-hmm.
And they used to go home in a suitcase every night and were arranged in piles according to first the dose, the chemical, the age of the women, how many children they'd had. And suddenly the penny dropped that where the 2 hormones were equally distributed in the market, and I got that data from Intercontinental Medical Statistics,
Sure.
there was a 52-48% split.
Mm-hmm.
There was a huge excess, relative excess of the larger doses, irrespective of what chemical it was.
Yeah.
And that, at that stage, I hadn't looked at the progestogen. And I advised the authorities not to publish anything until we'd had time to do that. But Mr. Crossman wanted something to say in Parliament, and as you know, just before Christmas in 1969, the so to say in America, it hit the fan, and
Yes.
and the committee was heavily criticised.
Can you tell us just a bit more about this? Because there was a leak, wasn't there, to Chapman Pincher, I think, of the Daily Express.
Yes, I had predicted that if we held a conference with the industry, because they are legally obliged to inform their masters in America,
Yes.
That the FDA would have to have the story within 24 hours.
Yeah.
And I predicted then that there would be an automatic leak to the Washington Post through Mr. Morton Mintz, who usually, I think they used it as a sort of safety valve really to take the heat out of some of these things.
Sure.
But I was wrong, because in fact Chapman Pincher had it a day earlier.
Mm-hmm. And the doctors hadn't been informed.
And the doctors hadn't been informed. Now the committee then were forced to produce an urgent yellow pill, which was a piece of A5 paper typed by an ordinary typewriter,
Yeah.
and tried to fob that off as one of their one of the leaflets in their adverse reaction series, and this fooled nobody. They were even more insulted.
Yes.
After receiving this pathetic little bit of paper.
Yeah. Yes.
So the end of the story really was I got the nickname of father of the mini pill in respectable circles, and Bill the Pill in the eyes of the industry, who weren't too pleased about this.
A lot of women came off the pill, didn't they? I mean, there was a lot of scariness.
It's alleged that some did. George Godborough, and I never knew whether he was fooling or not, the following 9 months later claimed that I'd caused a slight eruption in the population.
Yes.
I said, well, you know, I'm a man that I can still move around. I'm probably the father of a lot more than I bargained for.
So this almost brings us to the end of the Committee on the Safety of Drugs.
It actually overlaps the end, yes, because
Which was what, 1970 or something?
the main paper on oestrogen dose was published in 1970.
Yeah.
Immediately, soon after Christmas, furor as we could get it out. By which time I'd been to Sweden and to Denmark and got all their data, and it showed exactly the same thing.
Yes. And then we get the Medicines
And
Act.
from that September 71, I think it was, the Medicines Act became operative, and everything changed.
I see. So finally, what do you think the main lessons we learnt from this period?
I think I learned 3 things. First of all, the value of independence. Secondly, the need for transparency, the ability to communicate freely with people outside. And thirdly, the need for more information about the efficacy of drugs. And if I take the last one first, I think that was a serious defect in the Act, probably initiated by pressure from the industry. But many other countries now insist that a new drug has to have a margin of superiority or to be very considerably safer. And so in other words, you've got to have the complete equation, relative safety and relative efficacy, and the Medicines Act prohibits this, really, these considerations. As far as the independence is concerned, I always felt that it was a great mistake to expect doctors and other scientists working in the department to be loyal to a scientifically independent committee on one hand and to the Minister of the day on the other hand. There may be perfectly good reasons why ministerial decisions clash apparently with the scientific decisions, and if they were separate, these problems wouldn't arise. I think the doctors now working at the department now find themselves more as medical advocates rather than being free to communicate scientifically.
Thank you, Bill, very much.
Well, it's my pleasure, Stephen. Thank you very much.